we are going to talk about gastric sleeve versus gastric bypass. When is one of those necessary? Well, first of all, both of them are great surgeries for the obesity treatment. Both of them control your obesity for a very long term. So you hear these two surgeries have good a good effect on the obesity problem, and the question is, which one is better? Well, the thing is, we are very different. Patients are different, the necessities are different. This is one thing you need to know. The other thing is, well, how are these surgeries done? Okay, we're going to start talking about the gastric sleeve. The gastric sleeve is a reduction of your stomach size. Where your new stomach, it's going to be a 20% approximately of the size of your old stomach. This is making your new stomach look like a long tube. The 80% of the stomach you take out has a hormone that's called ghrelin, and this hormone is a craving or appetite hormone. So appetite and craving is very well controlled on the gastric sleeve, and there is restriction. This is the way how gastric sleeve controls the weight loss, by restriction and hormonal control. The gastric bypass is done a lot different. You separate the stomach, making a new small pouch on the upper part of the stomach, and then the intestine, you go and connect it on the upper part of this pouch. So the food when you eat has a restriction because there's a small pouch, and you jump approximately like 100 to 150 centimeters of intestine or digestive tract where you do not absorb calories, and sometimes you absorb less iron, so you're gonna have to have in lower times, in less of the times, some supplements intakes with the gastric bypass. Well, the gastric sleeve and the gastric bypass have a similar rate of weight loss, but the gastric bypass has a little bit of more advantage with people that suffer from diabetes or metabolic problems associated with the obesity. In gastric sleeve, you are going to have a remission of the diabetes, or you don't need, the thing is that you don't need to have medication or insulin in like 70% of the cases with diabetes. In the gastric bypass, it's going to be like 90% of the times with people with diabetes. So this is a start. If you have diabetes, you have to consider that gastric bypass is going to be a little more effective for treating weight loss and diabetes, but gastric sleeve is not that bad. And the other thing is that when you have a high or a very difficult reflux disease, bypass is going to cure it. In fact, the bypass started as a surgery for reflux control. By separating the stomach, like I told you, from the upper part, there isn't going to be any reflux to the esophagus. So this is another portion of the people that have to consider bypass as their surgery when they have obesity. Sweet eaters have a little bit more effect on weight loss with the bypass surgery than the gastric sleeve. But this is very important. If you're going to have obesity surgery on either of the either surgery, you need to have a different way of life. You do not need to continue living, eating the same things you did before surgery. So, on the end, both of them have uh, almost the same percentage of weight loss. The pluses on the bypass is on diabetic people and reflux disease. And the pluses of the gastric sleeve are that people that have obesity on this kind of surgery do not alter a lot their anatomy, and they have the same digestive tract. Even though their stomach is smaller, you don't have any more manipulation just on the stomach. Supplements are rarely needed on a gastric sleeve. And then, if you think about this, maybe it's not a priority to think about this, but maybe a gastric sleeve can convert to a gastric bypass if needed. Well, the thing is, both of these surgeries are very good. Bypass is an older surgery, but continues being as effective as a gastric sleeve. And it's your choice, a choice you need to make with your surgeon and your surgery team. Thank you very much for listening. I'm Dr. Rafael Abril. If you have more questions, please contact us at Hospital Hispanoamericano.
If you want to know more, please contact us.